think the purpose of these arches is? Yes. So what do we call that? Collateral blood flow. So that if the radial artery gets occluded, do you lose your hand? No. The ulnar artery can provide collateral blood flow to that same distribution, that same territory.
The two arches were the superficial and the deep.
Yeah, the superficial and the deep palmar arch. And the digital arteries come off the superficial.
Thank you.
Okay. Now, the aortic arch gives rise to the posterior, to the descending thoracic aorta. The major branches of the descending thoracic aorta are simply intercostal arteries. Okay. Arteries that are providing blood flow to the ribs and the intercostal spaces, chest wall. Okay. But once that descending thoracic aorta passes through an opening in the diaphragm, it becomes the abdominal aorta. And what I want to point out in this picture is that there are 3 unbranched vessels that come off the anterior wall of the abdominal aorta. And the key word there is unbranched. Okay? For instance, there are a pair of renal arteries, but that's a pair, it's not a branch. So the right and left renal arteries come off the abdominal aorta and supply blood flow to the kids. But that's not what I'm talking about now. I use the term unpaired. There are 3 unpaired branches from the abdominal aorta, and their names are the celiac trunk, it comes off right below the diaphragm, celiac, C-E-L-I-A-C, celiac trunk. It's called the trunk because it's got lots of branches. Okay. Then if we go a little further down, this unpaired branch is called the superior mesenteric artery, SMA. Superior mesenteric artery. And a little further down, this unpaired branch right here is called the inferior mesenteric artery. That makes sense. If you have a superior, it would be nice to have an inferior. Can I erase this picture now?
Yes.
Everybody's got it? So let's picture the diaphragm here. Let's picture the abdominal aorta coming down like this. And somewhere around L4, it's going to bifurcate like this. Let's draw in the celiac trunk, superior mesenteric artery, inferior mesenteric artery. The SMA, by the way, comes off right above the point where the renals come off. I'm going to do. I'm going to throw in here, I'm going to superimpose the inguinal ligaments. Y'all know what the inguinal ligaments are, huh?
Yes.
They pass from as is to the pubic symphysis. Any structures that have to reach the lower extremity pass deep to the inguinal ligaments. When the abdominal aorta bifurcates, these two branches are called the right and left common iliac arteries. Right and left common. So what do we know already about those common iliacs?
That there's two of them.
Well, that there's a right and left, yes, very good. But the fact that the name is common,
Branch.
they're going to bifurcate. So each is going to give rise to an internal iliac and an external iliac. That's the external. This is the internal. Now this is an important concept, particularly in pharmacology, believe it or not. The internal iliac artery is going to provide blood flow to pelvic organs. So the internal iliac might supply, for instance, the bladder, reproductive organs, the rectum. I said it. Stuff that's within the true pelvis. Whereas the external iliac is going to pass deep to the inguinal ligament on both sides. And then once it passes deep, it's no longer called the external iliac, it becomes the femoral artery. This would be the right femoral artery. And we can palpate its pulse, by the way. Back in the day, when you took A&P1, and we talked about navel, remember that?
Mm-hmm.
Okay. It's just a mnemonic for memorizing the sequence of structures that pass deep to the inguinal ligament. Okay. And so, lateral to this femoral artery, we have a nerve, which would be the femoral nerve. Medial to the femoral artery, we're going to have a vein called the femoral vein. Then we said there's an empty space, and then some femoral lymphatics that come up like this. So that it creates this mnemonic that goes nerve, artery, vein, empty space, lymphatic, from lateral to medial. So that if you want to do a femoral vein puncture, you palpate the femoral artery pulse, and then you go about a finger breadth medial to it, and that's where you stick. Do veins provide pulses?
No.
No. Veins do not provide pulsatile flow. That's only arteries. I told you about the big old lawsuit one of the nurses got into, huh? Yeah. Because she noted where to palpate for the femoral vein. She thought she put the needle, instead of putting it medial, she put it lateral. Yeah, she bisected the nerve. Okay, that sucks. That's how life is sometimes. Life is
No,
full
just
of...
like you get that, dealt that hand of cards that you just had to be that guy that got the wrong nurse.
Sometimes, but for the nurse too, sometimes life just sucks, you know? And everybody's got their trials and tribulations. You know, you happen to to get hired by a company to work in the medical field, and lo and behold, we have a Dr. Delacroix that works there.
Or you're in
Yeah.
town.
Yeah, sometimes life just sucks. That just happens. Okay. Now, let's go back to the celiac trunk. It's going to provide blood flow to all of the upper abdominal viscera. What does the word viscera mean?
And,
No, what does viscera mean? Say.
oh,
Organs, right, all the upper abdominal organs. So, it's going to supply, look here, let's move it off the color. And I'm going to go, the way I think of it is I start in the right upper quadrant and go to the left upper quadrant. Okay? So it's going to be gallbladder and liver. Okay? Because that's kind of on the right side. As I go to the middle, I think of stomach and duodenum. Okay. The duodenum is the first part of the small intestine. So food leaves the stomach, enters into the duodenum. And then let's move to that side. I'm going to pick up the spleen and pancreas. So what the celiac trunk is doing is it's giving blood flow to all of these upper abdominal viscera. Now, for right now, we're going to say the superior mesenteric artery supplies the right half of the intestines. Inferior mesenteric. Okay, so this is going to kind of go to this side. Inferior mesenteric artery, the left half of the intestines. So by intestines, I mean small and large. So this is going to travel kind of this way. Is everybody good? Oh man, I hate when this happens. Oh man, but this has been happening. You know, this has been happening a lot with this computer. So you got to start all over. But y'all need a break. I kind of felt that maybe y'all needed a break, did you? That's all right. We can pull it up again. We just have to enter again.
Here, are you?
Me? I was looking at my friend to see what you could see.
Let's see something. I think Jordan's doing something good. She's looked at red bread. You know,
Can I have some organs out?
you can take organs out. You can look at the wall, man. All the blood vessels are displayed here. We have pictures here. All right, come over here. I want everybody to come over here. This is good. Here, we just happen to see the abdominal aorta here. What do you think these vessels are here?
To the kids.
Those are to the kids, so that would be the right and left renal artery. Now, we have to pick up a vessel that's coming down to the left side and branching. What do you think this one is? Inferior, right, it's coming to the left side. Here is, all right, here we see the bifurcation. What are these two vessels here? Okay. And then what are these here?
the internal.
Internal iliac, so that this is external iliac. You see a catheter coming up, by the way. Okay. In other words, a femoral artery puncture was performed. They used that access to advance a catheter, so that catheter is being advanced all the way up the abdominal aorta. All right, let's do that. It's, I can show you.
I know, but like when I pass up here, but.
Oh, no, you're just gonna look at it. We're not gonna, because I want you to figure it out. That's the whole point. Yeah, so I made sure I didn't mark anything, because that would kind of defeat the purpose.
Who's Sanders?
That was just a patient. I should have blocked that out. She said.
I'm sorry. I'll tell on the next time.
I had extension in Thailand. Two. I think you need.
The one that I tripped.
Does anyone have the PowerPoint, by the way? I know I surprised you by changing. No, the PowerPoint. Did anyone print out the PowerPoint?
Yeah, I think I did.
Let's see it. Because it might be that was the last slide on that
It
PowerPoint.
was the last one. It was.
Hold on.
Okay.
Wait, this one?
Let's see. No, that's what we work on.
This one.
It was, okay.
Oh, this one.
Forward.
Just a minute.
We're gonna matriculate it.
Hold it.
Wall man.
The wall. Yes.
Okay, so you see, by the way, this blood vessel list. That's important.
Sarah, in speech today, we're just going over our outline for toast, right?
I think
Or like what it's supposed to kind of. Did you finish your other one?
Did I tell you all I gotta watch
Yeah,
for
I
Christmas?
know.
Same.
I like putting all of it.
What kind is it?
It's a, it came in a little aluminum box.